Hello, my name is Marc and I'm an acute care surgeon at Dell Seton Medical Center at the University of Texas in Austin. For this East Minute, I'll be discussing the role of fast-track pathways in acute care surgery. I'll be highlighting a recently published study from the group at the University of Texas Southwestern evaluating the benefit of a fast-track pathway in the management of acute cholecystitis. The shift towards value-based care has led to more focus on optimizing outcomes at decreased costs. In acute care surgery patients, it can be difficult for surgeons to control variables and optimize outcomes due to the emergent nature of the cases in patients with deranged physiology. Fast-track pathways are a multifaceted approach to perioperative care that aim to reduce morbidity, enhance recovery, and decrease length of stay without adversely affecting outcomes. As the authors of this study point out, this approach has been widely adopted in elective surgery, but has been slow to gain traction in the field of acute care surgery. This study evaluated the effect of a fast-track pathway in the management of acute cholecystitis. This was a retrospective, observational study of patients undergoing an urgent or emergent cholecystectomy. Patients managed at one hospital using the fast-track pathway were compared to patients managed at a separate hospital not using the pathway. The authors excluded patients who underwent an open or subtotal cholecystectomy. Primary endpoints focused on time and resource utilization, and secondary endpoints focused on outcomes. The fast-track pathway included standardized perioperative components. Preoperative risk assessment, optimization, and patient education was done in the emergency department by the operative team. Intraoperative component included laparoscopic surgery and multimodal analgesia. The postoperative component included additional education, standardized analgesia, and discharge from PACU when appropriate with a planned virtual follow-up visit. In total, 430 patients were managed through the fast-track pathway and 49 with the traditional pathway. Patients in the fast track were younger, more often female, and had less comorbidities. The fast track patients had a shorter length of stay, had lower hospital admission rates, were more frequently discharged from PACU, and had lower in-person clinic follow-up compared to the traditional pathway. The analysis found no difference in outcomes between the two pathways, and patients in the fast-track pathway were over 7 times more likely to be discharged within 24 hours from the time of consult. So in conclusion, this study shows that the implementation of a fast-track pathway can expedite the care of patients with acute cholecystitis and have similar outcomes to a traditional pathway. This study adds to the growing body of evidence that support various tools to expand the principles of value-based care to the field of acute care surgery. Thank you.